Okay, good morning, good afternoon. I'm not sure exactly what time it is that you'll be watching this, but today I'll be talking about my second genetics project, where I'll be going over three of the six genetic conditions that I researched throughout the second half of the semester. And up first, we have Klinefelter syndrome. And for this one, we were looking at a patient was seeking genetic testing or counseling after they were having issues having children. We had a patient in their 30s who had been trying with his wife to have children for 2 years, and they were unsuccessful. So after a lab genetics testing, or through the karyotyping, they realized that the patient was presented with an XXY set in his chromosomes, presenting as Klinefelter's syndrome. And the life expectancy for this genetic condition is only a year or two less than normal, so not as lethal as some other genetic conditions that we're looking at. Some common complications that we're going to look at is just right away, the one that we saw in our patient that caused his concern was the infertility. And we also will see some autoimmune problems, lung disease, and maybe even some weak bones. Some available treatments that we can use here are some hormone medications that can kind of help with the hormone imbalance presented by the 2X and 1Y chromosomes. Some fertility treatments that we can use, especially in this case where our patient is presented because he has fertility issues. Some plastic surgery to help with physical body appearance, and then speech therapy, because that can also be presented as an issue with this genetic condition. And then a support group we have for this one is the American Association for Klinefelter Syndrome. They can help you help you as you experience any problems or complications as you move forward living your life with Klinefelter syndrome. The next one we will talk about here is cystic fibrosis. For this one, we have an 11-year-old girl present with a lower than normal weight, frequent respiratory inflammation and infection. And she comes into the doctor's office, and after her DNA has been sequenced, it becomes clear that the young girl suffers from cystic fibrosis. And for this one, we have a median life expectancy of 27, so a little bit less than Klinefelter's, but still not as lethal as some of the other genetic conditions that we may see later on. And then for this one, it does require medical lab testing required for a diagnosis. Some common complications that we can see with this one, kind of presented with this young girl with her respiratory inflammation and issues, a cough, repeated lung infections, inability to gain weight, and fatty stools. We do have some available treatments for this, but there is no overarching cure that's going to be able to help in the long term. We can have some medicine for treatments or operations that may be able to help and provide therapy for this genetic condition. And we have one pretty big support group here in Claire's Place Foundation. It has a network of families and young adults standing by to support families or people newly diagnosed with cystic fibrosis or isolated families looking for assistance. So that's a good resource out there for families experiencing difficulties or complications with cystic fibrosis. They can reach out to them and receive some assistance there. And for the third genetic condition that we're going to look at today is Walker-Warburg syndrome. I have been kind of having some issues pronouncing that second word there, but it is what it is sometimes. The gene associated with this condition is the twisted or DMEL-TW gene. It has 11 genetic terms associated with it through the Flybase database. Well, that was where we did our extensive research for this one. In the flies that we were looking at, it presents itself in the enlarged primordium, the tracheal system, the digestive system, and the integumentary system. So this gene is expressed in all of those different organ system throughout development, and it has interactions with the RT and DG genes. And in the case for humans, a diagnosis for this requires lab testing that can be through a premature fetal MRI confirmed through laboratory testing after birth. And this one, we are experiencing some pretty severe complications. It affects the development of the muscles, brain, and eyes, and it is in the most severe group of genetic conditions known as congenital muscular dystrophies, which cause muscle weakness, wasting, or atrophy beginning very early in life. And this one is pretty severe and is often very lethal, and the life expectancy for this one is often less than 3 years. There's currently no cure for this genetic condition, and at this time treatment is individualized based on specific symptoms, and these treatments can be anti-seizure medication, surgery for hydrocephalus, such as implementation of shuts to drain excess cerebrospinal fluid to reduce pressure, and physical therapy to improve muscle strength and prevent contractures. And a big support group for this one is often presented as extremely rare. So we have the National Organization for Rare Disorders. And this is an organization that is available to support families or individuals suffering from this condition, as well as many other conditions. And so that's all I have for today. That's going over three of the last 6 genetic conditions that I researched and studied over the last half of the genetics lab semester. Thank you very much.